extension. Any experience from any of the audience? So practically speaking, this L3 fracture, alpha fracture, I don't think TLSO base works. So what is your take on that?
See,
That type of conservative management of those fractures.
only idea of the brace is just to remind to the patient that he had an injury and so that he don't do any abnormal movements. Any brace, even in a compression fracture or a trauma, if you are going to use any one of the ready-made braces, is not going to work in any sense. But it just reminds the patient that something is wrong and they would not do any sudden movements or bending movements. But basically, it depends on the comfort of the patient. As he mentioned, you have to take a standing radiograph, and if you find the very simple thing is when you see the X-ray, you find the end plates are not parallel. The upper end plate is like this. That means it is an unstable type. Even if you measure the angle, you get 20 degrees. You know that it is bound to progress. Within the first 1 week, the two end plates, one upper end plate started to tilt. That means it's going into kyphosis. It's safer to instrument that is a relatively safe surgery. You can be more aggressive in trauma, but be less aggressive in degenerative spine. But unfortunately, as surgeons, we tend to be more aggressive in degenerative spine and trying to be less aggressive in trauma. Trauma, the end results are usually very good. You just need to stabilize, you don't need to reconstruct. Whereas in the degenerative spine, it's not a one-time surgery. Therefore, about bracing, it doesn't make much difference unless it's a PLC injured patient where you have to put a hyperextension. In other scenarios, just for the comfort of the patient.
So 2 weeks is the time when we assess the fracture, where we are going, like whether it's going for more kyphosis, and then after that we decide whether we have to instrument or we have to again
very rarely you land in that time. But if you look at the literature, if you look at post-traumatic kyphosis, majority of the group of patients who develop post-traumatic kyphosis are missed injuries. That means the PLC injuries have been missed on initial evaluation, assumed to be a A3 or A4 injury, and that's why we tend to get diagnosis. Therefore, that's why you have to be very cautious about it. Therefore, when you look at the X-ray, we tend to look only in the front. We are looking mainly at the body, but always because you start reading X-ray better, you get to know whether it's necessary to operate or not.
So the last question: how many from the audiences have done anterior reconstruction either from anterior approach, lumbar or thoracic injury? So can you tell your indication for that? In a thoracolumbar traumatic injuries.
10 years ago, yes. Today, zero.
So in let's say in last 5 years, last 3 years, anybody has done anterior reconstruction from anterior approach?
Sir,
Your indication, sir?
once L4 burst, which I was not able to restore the eye. All from posterior. So went back in state surgery though. Did an anterior with an expandable cage.
So I just this question from the speaker, like what are the indication for anterior reconstruction from posterior in today's time?
Like there is, as I mentioned, you would ask if there is no particularly definitive indication.
Something which you have done in last 3 years, like this patient like it.
See, whenever there is a significant combination of the anterior and lateral body, once you push or push an instrumentation, you don't create any distraction there to create excess void. Once you punched out the fragments, you get some sort of a continuity. You can always punch it more from there into the fragment. As I showed you, using the air punch, you can punch the fragment to
improved results with multidisciplinary treatment, almost 50% survival these days with multidisciplinary treatment. Poor prognostic factors are age more than 18, if the tumor is in the pelvis or the spine, the presence of metastasis at presentation, and a large primary neoplasm like this one, which is more than 8 centimeters. Thank you very much. With that, I would like to thank my panelists here. First and foremost, our guest today, Dr. Manisha Singh, who had presented us this fantastic case. Madam, we understand your grievance with spine surgeons or orthopedic surgeons. I would say that we also have the same grievance with you people because you are concerned with chemotherapy till the patient becomes paraplegic and then sent to us. Sorry for that. And the second thing is, thanks to all my colleagues here, Dr. Devanand, Dr. Priyank, Dr. Shankar, and Dr. Mihir, and thanks to the audience for a patient listening. There is going to be a general body meeting, which is probably on the first floor, which will start in about 10 minutes or so. Please do join us.
for your money. So we thought that there will be a central pool, or we'll get all the big companies and all the top board members can negotiate with them for the year. So they will sponsor for the whole year for the ASC side. Someone would like to sponsor some pages in the journal, someone would like to sponsor some books, someone would like to sponsor the outreach program, someone would like to sponsor the ICS or parts, so they get a premium slot in the is there. So that means essentially the central would give X amount and the local host the program and the functioning of the association. Not so. So we will have some local, so that interaction will be there. And so that is how it will run. This is how international organizations are run. And that is what Dr. Chabra has been saying for the last 2 years. The NAS, the Association of Spine Surgeons of America, and other European spine societies run that way. We have become a bigger organization. We need to move ahead rather than waiting for check from the organizers at the end of the conference. Anybody wants to say a quick word? Mahesh?
Sir, we need to I request everybody to relook at the strategy itself about requesting get this names, Disu, Metronics and all that. Having been a significant user of a particular company belonging to that category, I know that now they are no more interested in sponsoring an organization per se. Rather, they would spend the money in bits and pieces to catch hold of the potential their customers in tier 2, tier 3 cities, or even in the metros as an individual level to benefit, because it's end of the day, it's money which matters. The third part is with the NPPL looming large in the next 1 to 2 years. It is
बहुत बहुत खूब। मैं चाहूंगी बड़ी बड़ी तालियां हो जाए। फिल्म दिल है तुम्हारा से लिया हुआ प्यारा सा सॉन्ग। बहुत बहुत खूब।
There. Yes. I will be there. Thank you. Yes, I really appreciate Dr. Sinha and Dr. Anand's organization and the hospitality, and thank you very much. Patna always has a soft corner in our hearts, and I welcome you all for the next conference, which is in Bhubaneswar on 3rd, 4th, 5th November. Please welcome. Well, let me start by saying that what a wonderful evening this is.
Wow.
The weather gods have relented, and we have a nice cool breeze also blowing by, which is adding to the event. So somebody told me you must have the pani puri, which is better than Bombay's. I could not believe it, so I went and tasted, and it certainly was better than Bombay's. So thank you very much. Lovely evening. We've had a very pleasant time. I was here 4 months ago when Rajiv organized the Bihar Orthopedic Association conference, and I took the opportunity to visit both Gaya and to Rajgir, and what phenomenal place you live in. That you have such rich inheritance from the cultural inheritance, political inheritance, all of it is so rich. And we've had a lovely time being here. Thank you very much.
इतने बड़े से खुद कोमल है
या श्योर बिल्कुल। सर ने कहा आते वक्त ही कहा है कि बहुत अच्छी आवाज है। मैं चाहूंगी एक प्यारी सी झलक सर की आवाज जरूर हो।
Oh,
This is your evening. आप लोग चाहे मुझे यहाँ ज्वाइन कर सकते हैं. All the ladies here, आप लोग वैसे ये जो गाना है आप लोग के लिए बना हुआ है. आप लोग आगे आए, बहुत मजा आएगा सच में. और मैं आज हील्स नहीं पहन के आई हूँ क्योंकि मुझे लगा आज डॉक्टर्स लोग हैं, everybody wants to party, तो आज मैं भी पूरी पार्टी मोड में हूँ. तो आप लोग सब प्लीज यहाँ मुझे ज्वाइन कीजिए. All the chants in the house. आ जाइए एवरीबडी. यहाँ पे सर आ जाइए. रेत ही रेत थी मेरे रेत ही रेत थी क्या सही प्यारी जिंदगी है क्या सही प्यारी जिंदगी है. आप मेरे साथ जाइए. आ जाइए आ जाइए Is she alright? में आ जाइए, आइए आइए, बिल्कुल बिल्कुल बिल्कुल, ये तो पूरी शाम पड़ी है इसके लिए। अभी ना आप इनके लिए डेडिकेट करेंगे, आप इनके लिए डेडिकेट करेंगे, और भी जितने कपल्स हैं आप आगे आ सकते हैं। अपनी चांद जैसी महबूबा के लिए कुछ लाइनें तो बनती हैं। बुलाइए बुलाइए सब, सर अपनी मैडम्स को बुलाइए यहाँ पे, आइए आइए आइए, ये पे। जी कर बेखदारवा कितना सोना तन रब ने बनाया, कितना सोना तन रब ने बनाया। जी कर बेखदारवा दिल मुड़दा ने लंग समझाया, ओ दिल मुड़दा ने लंग समझाया। जी कर बेखदारवा रब ने बनाया, रब ने बनाया। जिगर धड़कन बेतहाशा तड़पने लगी, धड़कन बेतहाशा तड़पने लगी। तेरे ऐसा लगा दर्द ऐसा लगा, तेरे ऐसा लगा दर्द ऐसा लगा। तुमको खाए मजा मेरे रिश्ते कमर मेरे नजर से मिलाए मजा ओ मेरे This is your evening. आप लोग चाहे मुझे यहाँ ज्वाइन कर सकते हैं। All the ladies here, आप लोग वैसे ये जो गाना है आप लोग के लिए बना हुआ है। आप लोग आगे आए, बहुत मजा आएगा सच में। और मैं आज हील्स नहीं पहन के आई हूँ क्योंकि मुझे लगा आज डॉक्टर्स लोग हैं, everybody wants to party, तो आज मैं भी पूरी पार्टी मोड में हूँ। तो आप लोग सब प्लीज यहाँ मुझे ज्वाइन कीजिए। All the chants in the house. आ जाइए प्लीज एवरीबडी। यहाँ पे सर आ जाइए। रेत ही रेत थी मेरे रेत ही रेत थी मेरे क्या सही बिल्कुल बिल्कुल बिल्कुल, ये तो पूरी शाम बढ़िया इसकी। अभी ना आप इनके लिए डेडिकेट करेंगे, आप इनके लिए डेडिकेट करेंगे, और भी जितने कपल्स हैं आप आगे आ सकते हैं। अपनी जान जैसी महबूबा के लिए कुछ लाइनें तो बनती हैं। बुलाइए बुलाइए सब सर अपनी मैडम्स को बुलाइए यहाँ पे। आइए आइए आइए, ये
Oh